were previously heard. I didn't know that. That's okay. Thank you.
Madam Chair, Senator Monning, Fred Main on behalf of San Isidro, Fresno, and Humboldt PACE, the three newest PACE organizations in the state, and face the geographic disparity, perhaps the most based on the lack of access issues that go into their rate setting. They support item 9.
Thank you. Next witness.
Madam Chair, Senator Monning, Don Gilbert on behalf of Cal Optima, which is the county organized health system in Orange County. We too support item 9, the geographic disparity proposal. In short, Cal Optima's rates for their Cal Optima PACE program are about the lowest in the state, and this proposal would help square up the rates to the costs. Thank you very much.
Thank you. Next witness.
Nicole Wertelman on behalf of Innovage, a PACE program in San Bernardino County. Like all of the PACE programs with the problem of the geographic rate disparity, we're in that situation. A lot of our members come in and they've had severe problems with access to care and really need time and a lot of care to get back into working shape. I also wanted to say on behalf of the Ventura County Board of Supervisors, support for the Adolescent Family Life Program, and on behalf of the Alameda County Board of Supervisors, support for healthcare for all Californians. We cover everyone in Alameda County with a Medi-Cal benefit package and believe everyone is deserving of healthcare.
Thank you. Next witness.
Jody Hicks, representing the California Podiatric Medical Association in support of full restoration for podiatric services. And I would just note recently the Department of Healthcare Services has reinstated podiatry services in emergency rooms and also in hospitals because of the need for things like diabetic foot care and things that were being treated by emergency room services or emergency room physicians, and were not able to get podiatrists in and being paid for their services. So they are now, but there still is question of follow-up care and when they go to their offices and some confusion over billing. So we would support full restoration to get rid of the confusion over billing services, but also so that they can, those Medi-Cal patients can be seen in totality, not just when they're in the emergency room. Also here on behalf of the California Academy of Family Physicians in support of item number 27, funding for the Song Brown program. And you appropriated $8 million to that program last year for both expanding it for not just family physicians, but primary care, and also for new slots specifically. And we supported that, thankful for that, but want to ensure that moving forward, especially for the grants that were awarded to open up new residency slots, that they're able to keep going on an ongoing basis. And just note that there was about $7 million in grant applications to give out the $4 million. So there is a need, and we know that, so we support that. And then also item number 10 for Medi-Cal services for all. We support that as well. Thank you.
Appreciate it. Next witness, 2 minutes.
Good evening, Brianna Pittman with the California Dental Association. In regards to item number 1, optional benefits for adult dental, CDA strongly believes that all adults should have access to comprehensive dental care, but first we need to focus on fixing our currently broken Medi-Cal Denti-Cal system. Our rates are some of the lowest in the nation, and access to care is a significant problem, and we feel that adding more covered services without taking steps to address these ongoing issues will only exacerbate the problem. In regards to item number 13, the Children's Dental Disease Prevention Program, we are also fully supportive of school-based oral health programs, but believe that, however, any programs implemented should be part of a statewide evidence-based plan. And we expect that the dental director that was authorized in last year's budget in the Department of Public Health will be coming on board in the next couple of months. And we look forward to working with them to put in place a comprehensive plan based on best practices for oral health, hopefully including school-based programs like this one. Thank you.
Thank you. Next witness.
Good afternoon. Craig Pulsfer representing AIDS Project Los Angeles and the California HIV Alliance, here to urge the committee to support the proposals put forth by the HIV Alliance. We really believe we're the turning point in the epidemic, and we put together this really targeted set of proposals that we think are the first steps toward ending the epidemic here in California. So other jurisdictions have already done this. New York, San Francisco have put together plans to end the epidemic, and we think these are really the first steps to do that. So I want to thank the committee for its analysis of our proposal to increase eligibility for ADAP and OAHIP. As noted in the analysis, this will have no general fund impact and will result in cost savings in subsequent years. Also call attention to the proposal for pre-exposure prophylaxis or PrEP. As you know, this is a new prevention option. It's 99% effective at preventing HIV. So it's critical that we make sure people know about this and have access to it. So I urge the committee to consider this proposal. And my colleague will discuss the other proposals from the Alliance. And I just want to call attention to one thing, the AIDS waiver proposal to increase provider rates. So AIDS Project Los Angeles has been working on this with DHCS for the past 3 or 4 years to increase these rates. Most of them were last increased 12 years ago in 2001. We were actually told by a DHCS official that these would be addressed in this year's budget, and then in March of this year, we were told that this would not be happening. So I just urge the committee to really look at this proposal to make sure that this program remains intact for people living with HIV and AIDS. Thank you.
Thank you. Next witness, 2 minutes, please.
Thank you very much. Ann Donnelly with Project Inform and the HIV Alliance. On item number 18, which is a part of this package, it's $3 million for ADAP and insurance program stability. The enrollment workers are the interface between the client and these life-saving programs. And right now, due to dramatic increases in caseload and the need to develop new systems, the interface is experiencing many challenges, some of which have resulted in serious disruption to HIV care. As one example, in some rural areas, there's an 8-week wait time to even get into an ADAP enrollment appointment. We also believe that this $3 million can be taken from the amount of money that is going back to the federal government right now. This year, the State Office of AIDS sent back $11.2 million to the federal government. Item number 19 is $3 million for high-impact evidence-based HIV services in the under-resourced counties. The cuts in 2009 were devastating to these small and mid-sized counties. There's been a huge loss of infrastructure. HIV prevention programs were eliminated altogether. By way of one example, within 1 year of these cuts, the number of clients that moved from Ryan White to the AIDS waiver program in Nevada County doubled. Nevada County. So these counties are struggling to address this epidemic prevention and care with private funding only. So we urge you to support this entire package, and thank you. And then one last item, Project Inform supports item number 15, which is $10 million in STD prevention funding. Thank you so much.
Thank you very much. Next witness, 2 minutes, please.
Thank you. Good evening. My name is Tom Sigmuth. I'm Director of HIV Services from Ultimate Health Services in Southern California. And I'm going to share a story of a patient that's benefiting from the Medi-Cal AIDS waiver program. I'm going to call her Linda for confidentiality purposes. Linda is 60 years old, Hispanic female, diagnosed with HIV in 2006. In 2010, she lost eyesight as a result of an HIV-associated infection, and it is seen in late-stage disease. She resides with her daughter in a small 2-bedroom house in South Los Angeles. Her daughter is unable to tend to all of her needs. Linda is very isolated and has dealt with depression since her discovery, and since she was diagnosed as HIV positive. Her symptoms only worsened when she lost her vision and began to experience complications with her health. Linda was very independent and a vibrant woman who managed her own business, but now she is isolated and dependent and at risk for falls. The Medi-Cal AIDS waiver program has provided her with ongoing support and assistance in managing her health, addressing her depression, improving compliance issues, which have linked her to needed community benefits programs. And I strongly urge the committee to consider our ask. The Medi-Cal waiver program has provided critical support for our patients, which could have resulted in hospitalization, ER, emergency room, as well as admittance to nursing homes. Thank you.
Thank you so much. Next witness, under 2 minutes, please.
I will do my best. Good evening. My name is Susan Farrington. I'm the Executive Director of the Sierra Foothills AIDS Foundation, and I'm also here to speak about the AIDS Medi-Cal waiver program. My agency implements this program in Alpine, El Dorado, Nevada, and Placer counties. I speak for all of the Medi-Cal waiver providers in Northern California, saying that our present reimbursement rates are causing us to lose money on each and every client that we serve. Many of my colleagues are considering dissolving their programs as a result result of this income disparity. I urge you to consider increasing these rates and providing support for this vital service. People die without this program. I watch it all the time in my communities. Thank you for your time.
Thank you. Next witness.
Hi, thank you. My name is Claire Feldman, and I'm a director at California Family Health Council. We really appreciate the opportunity to talk about public health issues today because sexually transmitted disease, STD prevention in California is woefully unfunded. STD rates in California are high and rising. More than 1 million Californians are estimated to have an STD, and California spends over $1 billion every year on STD-related costs. Young people, men who have sex with men, and communities of color are disproportionately impacted. Over half of all STDs occur among young people. STD rates among African Americans are up to 26 times higher than white counterparts. And California is number 2 for their syphilis rates across the nation. If untreated, STDs can cause serious long-term health consequences, including infertility, and can also increase the transmission of HIV. California currently provides only $1.6 million for all STD prevention-related activities, and some health jurisdictions receive as little as $5,000 every year for STD prevention. This is not nearly enough to start moving the needle in the right direction. Now is really the time for the state to invest in STD prevention, and we are a broad coalition of partner organizations that are asking the state to increase this investment by $10 million to support evidence-based coordinated STD prevention activities. I also want to mention that we support funding for Hep C and HIV activities as well. Thank you.
Thank you. Next witness.
Madam Chair and members, Rand Martin on behalf of the, did I just say members? Member, Senator Monning, on behalf of the AIDS Healthcare Foundation. You all know AHF very well. What you may not know is that AHF also happens to be one of the largest STD testers, which is why we are a sponsor of the proposal to augment the STD control branch by $10 million. There is a direct correlation, probably appears obvious to most people, between STD, the STD epidemic, and the HIV epidemic. DPH did a study in 2011 that empirically demonstrated that correlation, comparing HIV rates among a variety of different populations with other STDs, and found a direct correlation. Also concluded that the more we identify people with STDs, the more likely we are to identify people with HIV who have otherwise not been identified. We've done some great work in terms of making sure that testing in California for HIV is robust. Thanks in large part, Madam Chair, to your hard work on this last session. And it's time to extend that to the STD world as well. As we have often said, there are more than 5,000 new infections of HIV every year in this state. 70% of those are caused by people who don't know that they're HIV positive. The more people we test for STD, the more people will identify with HIV, and the more people will get into care and treatment. Thank you for your support.
Thank you. Next witness, under 2 minutes, please.
Yes, I'm Laura Thomas with the Drug Policy Alliance. Thank you, Senator Mitchell, for holding this hearing and for all of your support over the years. I'm here about item number 16, the overdose prevention efforts. Right now, about 8 Californians lose their life every day because of a drug overdose. Drug overdose, accidental drug overdose, has become the leading cause of accidental death in California and in the United States as a whole. It kills more people than motor vehicle accidents. It kills more people than homicides. And despite that, California has not invested any funds into any of the very effective interventions that can prevent an overdose from becoming fatal or prevent an overdose from happening at all. And one of the most effective tools that we have is naloxone. It's a medication that immediately reverses an opiate overdose. That's all that it does. It's not intoxicating. It reverses intoxication. And if you don't have any opiates, it will have no impact on you at all. And our proposal is for $2 million for funds to go to community organizations, to community programs to get naloxone into the hands of friends and family members, anyone who might be at the scene of an overdose. I've been working on this issue for several years, and as I go around the Capitol and I meet with legislators and staffers, Inevitably, everyone tells me that they know someone. They've lost a personal friend or family member, or they know someone who has. And it's well past time for California to take action to stop before every single person in this building has lost somebody to an overdose.
Thank you very much.
you.
Next witness. Under 2 minutes, please.
Yes. Good afternoon. My name is Leanne Brookstein, and I work for Harm Reduction Services, which is based here in Sacramento. We're already doing the type of training that this proposal would fund. Through our opiate overdose prevention and naloxone distribution program, we've trained 257 people in a little bit over a year, and we have 43 reported lives saved. And that's only the people who have come back and told us. We know the number is actually higher. And the big deal is that this entire program has cost us $19,000. So we train users themselves, friends, families, first responders. We train parents who have kids coming home from treatment or jail, which is when the kids are at highest risk for overdose. Our training kits that we give out cost less than $5 to make. We see an overwhelming number of people that are under 30 that started using opiates in their teens, and they're coming in from surrounding suburbs and counties such as Yolo, Placer, and El Dorado. This training is cheap, and it's highly, highly effective. Every day in my office, I see the positive impact that this program is having on people's lives in this region. So I'd like to ask you to please support the $2 million allocation to overdose prevention training. We could save 100 times more lives than what we've done so far.
Thank you very much. Next witness.
Good afternoon, Glenn Backus. I'll need about 75 seconds. And I work with Drug Policy Alliance and with Project Inform and California Hepatitis Alliance on their proposals related to HIV control, hepatitis C prevention and control, and the prevention of fatal drug overdose. I'm going to use the next 60 seconds to enter some information from Dr. Peter Davidson of UC Davis. He was the one who worked with us to help develop the range of estimates on what $2 million would mean. His estimates was that the $2 million investment would save hundreds of lives and tens of millions of dollars, and this is why. Programs that train drug users can reduce the economic and health benefit or health burden on communities. He did a recent analysis comparing counties that had a naloxone distribution program and those that did not, and found a statistically relevant or statistically significant decrease in the death rate in counties that had a program. About cost, he also did an analysis of what happens when people go to the ER after an opiate OD. There's about 12,000 ER visits a year from an opiate overdose. If people are given naloxone early, they don't need to be in the hospital as long. So currently, 53% of those 12,000 need to be hospitalized after going to the ER, and that costs $143 million. So we can reduce that by getting naloxone out to people who need it. So there's a strong cost benefit and human benefit to this $2 million investment, hundreds of fewer funerals for families through this investment. Thank you.
Thank you. Next witness, please.
Hi, I'm Emily Hirio from the California Hepatitis Alliance, and we've come before you previously, and we appreciate your serious consideration of our proposal for $8.6 million for rapid hepatitis C testing, linkage to care programs, and expanded syringe exchange and disposal services. Hepatitis C is the leading cause of liver cancer and the leading indication for liver transplant in the United States and in California, and disproportionately impacts low-income people, African Americans, Latinos, and Native American communities. And while most of the people with Hep C are baby boomers, most of the new infections are caused by sharing of injection equipment, and a large percentage of that is among people under 30 years of age. So you may have seen recently the news from Indiana of an HIV and hepatitis C outbreak caused by injection drug use. And that was a state that until last week did not have statewide legal syringe exchange and has little access to HIV and Hep C testing, and came out of an opioid pill use epidemic, which is a significant public health issue around the country, in California, particularly in rural and suburban areas. And we think investing in syringe exchange, Hep C testing, and linkage to care are critical interventions to avoid a similar outbreak in California, which has a number of counties without access to legal syringe exchange and with high rates of opioid pill use. I'm happy to answer any questions about our proposal. And just to add that the Alliance supports the proposals related to HIV, STD, and drug overdose. And I would add that I ran a drug overdose program in San Francisco for a number of years. And the number of opioid deaths went from 100 a year to 10, in large part because of that program.
Thank you very much. Next witness.
Catherine Wazo, primary care doctor and Hep C treatment specialist. Talking about Hep C, very exciting time on an individual level. We have cure on a societal level right now. We're really trying to think about and work towards eradication. Unfortunately, new Hep C infections are increasing at an alarming rate. In the United States in 2012, there were 16,000 new infections. 2 years later, 2013, there were almost 30,000 new infections. It could be this year they're going to be 60,000 new infections. How do we change this trajectory? Of course, the primary reason that young people are getting infected is IV drug use. Prevention is absolutely the key. Primary prevention, we can't get away from it. There is no vaccine that's going to be coming up in the near future for Hep C. This is not smallpox. This is not polio. This is a small 7-gene virus. It's incredibly stupid. It replicates at very high rates, and it has no proofreading mechanism. So it outsmarts, well, vaccine is not able to be effective. So I really am supporting increased needle exchange. We all know that that does not promote IV drug use, just like giving young people access to contraception and HPV vaccination does not increase sexual activity. So secondary prevention of hepatitis C with rapid Hep C test kits, diagnosing the disease. We can't help these people if we don't know that they're infected. Remember that Hep C is primarily asymptomatic, especially in the early years.
I'm going to have to ask you to wrap it up, please.
Yeah. Okay, well, that pretty much does it.
Thank you very much. Next witness, I'm asking you for under 2 minutes.
Okay, I can do it. Thank you for the opportunity to speak, as well as for your perseverance today. I'm Gabrielle Lessard with the National Immigration Law Center, speaking in support of SB4. 3 quick points. Health insurance is a family issue. When one member of a family is uninsured, the entire family is in constant risk of a financial calamity. Second point, the economy also suffers when people are uninsured. People who are uninsured defer seeking care, and when they do become sick or injured, they miss more time from work recovering, which has costs for employers, for the tax revenues, and also for those individuals. People who have not had access to care also tend to retire early for health-related reasons, which puts more costs of recruiting and training replacement workers on employers. And then finally, the financial analysis of the cost of the bill distinguishes between scenarios where the president's action expanding the scope of deferred action goes into effect and does not. Our organization is closely monitoring and actively engaged with that litigation. We believe that the president will prevail, and we're not alone in that belief. A bipartisan group of prominent legal scholars has released a public statement and filed an amicus brief stating the position that we share, that the expansion of deferred action was a proper exercise of the president's prosecutorial discretion and will ultimately be implemented. Thank you
very much. Next witness, please.
Good evening, Madam Chair. Ronald Coleman here on behalf of the California Immigrant Policy Center, here in support of item 10 on the proposal to cover the remaining uninsured regardless of immigration status. As we all know, our immigration or our healthcare system discriminates. We need to right this wrong. As we've heard, we can do this for about $100 to $300 million, continue to leverage the 62% of funds we can draw down from the federal government and build comprehensive coverage on that we can get for PRU calls. Even without the president's actions, we can do this for 2 cents of every dollar that we're already spending on the Medi-Cal program. So we think the time is now, the time is urgent, and we must ensure that all Californians can access affordable health care. Thank you.
Hello, my name is Lucio Avila, and I'm with Centro La Familia and Advocacy Services in Fresno. And I'm here to support SB4. I completely support Health for All. I think prevention is the right thing to do instead of waiting for these folks to go to the emergency room. I'm a community organizer, so I see the community, that I work with the disadvantaged community, so I see the need for it. And also, the families I do work with, they completely support Health for All. Thank you.
Thank you. Next witness. I see people there with similar T-shirts on, so I'm going to ask you to identify one spokesperson from your group to kind of deliver the message, and the rest of you just share your names, please. Because you see, first there were 4, and now there is 1, and I'm fading.
Okay.
Okay.
Yeah, good evening.
Thank you. Good evening.
I'm going to be translating for Concepcion.
That's fine. Thank you.
Buenas tardes. Mi nombre es Concepción Castañón Calzada. Vengo de Porosville, California.
My name is Concepcion Castañón, and I come from Porterville, California.
Y vengo por la propuesta de que quiero que nos ayuden con las medicales para los emigrantes que no tenemos recursos económicos ni alguna aseguranza para nosotros. Incluso mi estado lo requiere por mis huesos que tengo enfermos, mis rodillas pegadas.
Yes, I'm here for the proposal for the SB4 to help myself. I'm actually suffering from arthritis in my knees, and so I'm undocumented, and I would really benefit from this proposal.
Y quiero pedirles, por favor, que se apiaden de uno que no tenemos los recursos para hacer una operación en mis rodillas.
And I would like to ask you to support this, that like myself, we don't have the access or the resources to get these kind of surgeries because of the fact that my immigration status.
Y pues gracias por todo y quiero que sigan la propuesta. Ojalá y Dios quiera que sí la pasen porque nos hace falta.
Thank you so much, and I hope that you support it and can pass this proposal.
Thank you very much for coming. I appreciate you.
My name is Daniel Peñalosa. I'm here on behalf of the CHIRLA, the Coalition for Humane Immigrant Rights of Los Angeles. I'm a statewide organizer for them. We have a statewide presence in the state, and we're here basically to urge the senators here who were able to make it to the whole day, but to really support the SB4. We know in the Central Valley, myself, we have our members who do suffer from Concepcion, who suffers from what's going on with health-related issues, and they cannot get that preventative care. They need help, and they really urge you guys to support it. We spend over $1 billion in emergency already in itself, so this would be the most moral thing to do and to help our state, which has a lot of immigrants that are undocumented that would really benefit from this.
Thank you very much. Appreciate it. Next witness.
Mi nombre es María Pérez, vengo con Chila, vivo en Puerto Villa, California. Estoy aquí pidiéndoles, hablándoles a su corazón, que es justo que todos tengamos y gocemos de una buena salud, y eso es lo que les pido.
And while in line, Señora Maria asked me to translate.
Yes.
So Señora Maria Gloria Perez here, she's asking today to reach out to your hearts to support Health for All and SB4 today, and she's coming all the way from Porterville, California.
Thank you very much. Appreciate it. Did you identify your spokesperson?
Yes.
It's
so
you.
Crescencio will be speaking on behalf of all of us. He's a youth from the Central Valley. My name is Amparo Alejandra Schur, and the
Excellent. So I'll come around the microphone so you'll all be on screen together. Okay, excellent.
Hey, my name is Crescencio Rodriguez, and I'm a college student at Fresno City College. And I'm here to support SB4, which would grant access to affordable healthcare to everybody despite their immigration status, because I believe in healthcare for all and not just for some. On several occasions, I've accompanied my mom to the clinic because she works in the fields of the Central Valley day in and day out without breaks oftentimes. And she has often found herself seeing the doctor but not being able to buy the medication that she has been prescribed. And so I believe that it's time to change that, and I believe that there should be access to affordable healthcare for everybody, not just for some.
Excellent. You nominated an excellent spokesperson. Thank you very much. I appreciate you. Thank you. Next witness, please.
We're here 2 for 1.
All right, beautiful.
Okay, my name is Juanita Ontiveros, and I'm with California Rural Legal Assistance Foundation, as well as my coworker, Noé Paramo. Just want to let you know that we're speaking on behalf and being the voices for the hundreds and hundreds of farm workers that we work with. Noé will speak for us.
Okay. Thank you.
Noé Paramo, I'm representing California Rural Legal Assistance Foundation. In support of item 10,
to expand Medi-Cal to cover the remaining uninsured. And secondly, to also item 4, to limit the state recovery for Medi-Cal. That also will help farm workers. Thank you very
Excellent.
much.
Thank you. Next witness.
Madam Chair, Paul Neprath on behalf of Planned Parenthood Affiliates of California. We're here to support a number of the items that help build the public health system in California and that have been underfunded. So item number 10, the Teen Pregnancy Prevention Program, restores funding to pre-2011 levels. We certainly want to support the California Family Health Council's STD prevention proposal. We think that's excellent. The Adolescent Family Life Program is one that Planned Parenthood has interacted with in supporting teen parents. We've seen the benefits of that program and think that deserves funding as well. But I wanted to focus the balance of my time on item number 5, which is our proposal on community clinic billing and reimbursement. This is a really important issue for Planned Parenthood and for community clinics. The current billing system is very complicated and in some cases denies clinics a dispensing fee for the drugs that they dispense on-site, and on-site dispensing is really important because it gets somebody their method of birth control or gets their testing and their treatment right away. So it's got a really strong public health benefit. Our proposal does 2 things. It will take the guesswork out of determining what the dispensing fee is, and it will simplify the formula for how the clinics will bill Medi-Cal and how the state will reimburse us. And while there's costs identified with changing the formula, we think that there will be a huge cost savings on behalf of the state as well as on behalf of the clinics that have to deal with the complicated nature of this particular item. And we think that this is a benefit for community clinics in California. Thank you.
Thank you very much. Appreciate it. Next witness.
Good evening. Excuse me. Good evening, Madam Chair, Ms. Bass. I'm here to, on behalf of SciMed, to urge restoration of the optional benefit of optical lab fabrication, meaning eyeglasses. Boiled down, what this would do, it would provide eyeglasses for adult Medi-Cal beneficiaries, non-disabled adults under 65 years of age. Most of these folks are beneficiaries because of Medi-Cal expansion, and they qualify for the enhanced Medi-Cal or enhanced federal match. So we think that the figures in the analysis in terms of general fund costs are a bit high and the federal matches are a bit low. But these folks now can get routine eye exams and refraction prescriptions, but no eyeglasses. And this would enable about 600,000 people a year to be able to find jobs, look for jobs, and lead a normal life. So we think it's an appropriate thing to be restored since it was eliminated in 2009. But ACA has brought all these people back into Medi-Cal or into Medi-Cal, and we think they should have a full eyeglass qualification. Thank you.
Thank you, Mr. Barnaby. Next witness, please.
Michelle Stoll-Parvensky, Children's Defense Fund, California, also here on behalf of the Children's Health Coverage Coalition, which includes my colleagues behind me, as well as Children Now, United Ways of California, and PICO California. We want to echo some of the comments made earlier about the importance of expanding coverage to Medi-Cal coverage to the remaining uninsured. Regardless of immigration status, there's 170,000 children in California who are uninsured due to immigration status, and we need to provide coverage to both them and their families. We know that's essential, and providing comprehensive Medi-Cal coverage is actually cheaper than the emergency Medi-Cal coverage that we're providing to a lot of children right now. In addition, want to speak in support of item number 3, investments in children's health. We actually have some additional money coming down from the federal government through the reauthorized and extended funding for the Children's Health Insurance Program, that there's going to be about $450 million in the budget year that we believe should be invested in improving outcomes for children who are in the Medi-Cal program, including improving access to care and enrolling uninsured children who are currently eligible for Medi-Cal into those programs. Thank you.
Thank you. And coalition members, feel free to say ditto.
All right, my name is Anna Hasselblad from California Coverage and Health Initiative, so ditto. And then I just wanted to expand a little bit on the need for outreach and enrollment funds to be allocated for children and as well as pregnant women. This is a time where we really need to harness the workforce that's already doing these outreach and enrollment activities. And there are the 160,000 children that are eligible right now and don't have that coverage and access to care. We believe that this is part of the No Wrong Door effort that we so strongly stand behind. knowing that there's ongoing Navigator funds, it only makes sense to support also Medi-Cal enrollment. So we see this as a very smart investment to get those kids in and then get them accessing care, especially preventative care. So thank you for your consideration.
Thank you very much. Next witness.
Ditto. This is Kathy Dressler from the Children's Health Coverage Coalition and the Children's Partnership specifically. Ditto with my coalition partners on everything they said, but I also wanted to point out our support for investing in raising the rates for pediatric dental access with some of that CHIP money, the $450 million to $600 million in the full budget year that will be available because of the enhanced rates that we'll be getting in CHIP. We feel that that is an essential access issue for Denti-Cal. And also just on the number 10, very supportive of that, expanding Medi-Cal for the uninsured. I want to point out that kids of undocumented are 2 times as likely to lack insurance as kids born to citizens, and that 1 in 6 California kids has an undocumented parent. 80% of those are citizens and don't have coverage. Thanks very much.
Thank you. Final witness of the evening.
Between you and dinner. Kathy Mossberg representing the San Francisco AIDS Foundation. Just want to not add to any more of the comments regarding the HIV advocates proposals as well as Hep C. Very much in support of those and encourage your approving those at the point in which you do that. On behalf of the California Family Health Council, in addition to the STD proposal, want to go on record in supporting the community clinic reimbursement. We think this is a cost saver in the end. There's a lot of money spent on redoing these things, and it's a complicated situation in which they're putting through the reimbursement now. And then on behalf of the Public Health Institute, want to go on record in supporting the Parkinson's Registry, as well as the investment in the STDs. Thank you.
Thank you very much. I'd like to thank, having been one of you many years of my career, I'd like to thank all the professional advocates and the lay advocates who have come up here and participated in the process today and bringing your proposals forward. We appreciate that. We'll be, of course, holding all those items open till post may revise, and we see what position the state is in to have a meaningful conversation about reinvestment. With that, thank you to LAO for hanging in today and Finance, and Sub 3 stands adjourned. Thank you very much.